father was a general surgeon, and so I started going to the operating room when I was probably 5 or 6 years old with him. I do hip and knee replacement or hip and knee arthroplasty almost exclusively. Everyone should have sort of a healthy apprehension or fear about surgery because it is a big deal, and if it's you on the table, it's always a big deal. Fortunately, a lot of those fears are not well-founded, and that, surgery is pretty safe in this day and age. If you look at it from a numbers standpoint, the odds are hugely in the patient's favor. If you look at all comers, the odds of a good outcome are overwhelmingly in the favor of the patient. When you're at a point where you're making more and more concessions in your life to the pain, then that's when it's time to give more consideration to the surgery. The analogy that my mentor used in fellowship is if you're walking along the top of a mountain and you fall and you catch yourself a few feet from the top, it's pretty easy to make the climb back to the top. If you tumble all the way to the bottom, it's a long, hard road back to the top and you may never get there. And so, I will use that story in patients in the office that, don't wait till you're so debilitated that you've lost all quality of life. That folks will come in and say, I don't know why I waited so long. This was the best decision that I ever made. Maybe not the first month or so, but on down the road, those are pretty common sentiments that we hear in the office.